minutes. So stick around for that. Right now, we are talking with the experts. We have experts here from Intermountain Healthcare, from a bunch of different, we talked to some folks from McKay-D this morning, and we have Dr. Brett Parkinson, and he is the head of imaging services for Intermountain at Intermountain Medical Center.
Right, the breast care center.
And he is my doctor. He's the one who helped me through everything and diagnosis and everything. So people have a lot of questions about mammograms, and you have some new technology.
We have new technology. We have what is called tomosynthesis, or 3D mammography, which actually picks up cancers at a slightly higher rate than the 2D mammography, which we have been using.
Okay, so why don't we do it then?
Well, we're actually starting to do it. We're doing it for diagnostic mammography, which is for women who have problems. But we are starting a screening program at Intermountain, and one of the insurance companies here in the Valley is actually going to be covering it. So it will be available to women whose insurance covers it, and to other women as well. They have to pay a small additional fee for that.
Well, and right now it's preventive care. I mean, it's going to diagnose, but is it just too expensive?
It is
more expensive than a mammogram?
It's a little bit more expensive, maybe about 15 to 20% more expensive, but it does have an increased cancer detection rate. Instead of picking up 4 cancers per 1,000 women screened, it picks up about 6.
Wow.
So that is a significant difference from conventional digital mammography.
Okay, and it's very similar. You have the same machine, because I've had it done. You have the same machine. It just takes a little bit longer of a picture.
Just a few seconds longer. And for the woman who doesn't really know, she's not even aware that she's having a 3D mammogram.
To have it more accurate is so helpful, though, for you.
Right. It's particularly helpful in women with dense breast tissue or very dense breast tissue. About 40% of Utah women have dense breast tissue.
And it can be uncomfortable to get a mammogram, and this can help just to keep the process a little bit quicker.
It's, actually, I hate to break that news to you, but it takes about the same amount of time, and it's still uncomfortable, but it shouldn't be painful. Especially,
but you don't have to come back in for the second and third looks.
No.
You can.
One of the nice things about this 3D mammography, it decreases the callback rate.
Right.
So we call back about 10% of women on average in the U.S., and with this new technique, the callback rate goes down to about 6 or 7%. So it saves time, it saves money, and it saves anxiety on the part of the patient.
And a lot of women have concerns about mammograms and exposure to different things. We have to talk about that later. But if you have any questions, call the number on your screen. These experts will be here until about 6 tonight, and they will be answering any questions you might have. Mammograms starting at age 40, right?
Age 40 annually, for as long as a woman is healthy.
Okay, thank you. We know that. We finish each other's sentences. Chase, now we need to get a look at the forecast.